It's 8:49 now at 95.3 WBCK. It's time to ask the expert, and our expert from Bronson, Battle Creek is Beverly Russell, a physician assistant at the Bronson Center for Colon and Rectal Diseases in Battle Creek and Marshall. And Beverly, very much into knowing and getting information out there about colon cancer awareness, helping individuals with colon and rectal health issues to lead a healthy and active life. And Beverly, good morning to you. Nice to have you with us today.
Good morning. Thank you for having me.
Glad you made it to work in one piece.
Yes, me too.
So we're going to talk about a subject today that it might be a little difficult to talk about. It's certainly difficult to talk about on the radio, but probably just as much so for people who suffer from fecal incontinence, or I guess pooping problems in the vernacular. What exactly are we talking about when we say fecal incontinence?
Generally, the term is used for people that have the inability to control their bowel movements, usually causing leakage or total loss of control with accidents.
How prevalent is this, Beverly?
It's more prevalent in the older population, greater than 60 years old. It affects about 8% of the population. It can happen in younger patients, but it's much less prevalent. Women tend to have a little more issues than men, mostly because of weakened pelvic floor muscles related to pregnancy and childbirth, although men can have issues after surgery for prostate cancer. That's one of the big ones that we see.
Well,
go ahead, sorry.
You know, when you quote these statistics, 8% over 60, it could be higher than that. I mean, I bet you a lot of patients come in, they don't even mention it because it's hard to talk about.
You're correct. We see a lot of ads on TV regarding urinary incontinence, and it seems to be the thing to talk about because you can, buy pads that, take care of the issue or help control the odor. But usually if someone is incontinent of stool, that's a very prevalent odor and not socially acceptable, so people don't really want to discuss it.
Well, do you think talking about urinary incontinence might be a step to get the discussion going?
Yes, and sometimes that's what I do in the office. When I see that a patient admits to that, then we also discuss whether or not there's stool involved.
Yeah. So what are some different options for treating fecal incontinence?
It depends on the severity. The initial treatment would be biofeedback, which is what I do in the office. It's a test we use to check the strength of the pelvic floor muscles, and then I prescribe exercises and things like that that the patients can do to try and strengthen that. We have about a 3-visit time frame over about 6 weeks. If that doesn't work, our office also does InterStim, which is a pacemaker instrument that helps regulate the sphincter and has, changed the lives in a whole lot of people.
Wow. So do you see a lot of people then recover from this? They come in and are able to put it behind them, no pun intended?
Yeah. Yes. If the biofeedback, if it's a mild case of incontinence where the muscle is still functioning but just not strong, we can strengthen that, and that has helped. But again, if we need to, we can use the InterStim, and we see a reduction in their incontinence between 75 and 100%.
My. If people have a question then about this, how can they get a hold of you?
They can visit bronsonhealth.com, or they can call our office at 269-441-1771, and we would be happy to make an appointment for them to come in and speak to us in a one-on-one private setting.
All right, great. Well, Beverly Russell, physician assistant, Bronson Center for Colon and Rectal Diseases in Battle Creek and Marshall. Thanks very much for talking to us today, and you be careful out there, okay?
Thank you very much. Have
All
a
right.
good day.
Yep, you too. Bye-bye.